It's challenging, as you know, to kind of like break into a health system. You're not just going to kind of like hand off the product and say, okay, see you later. The more people that you can talk to in the organization, the better. Doctors' offices use fax machines still. It's very sexy. It's more lucrative to work for a hospital. How can I provide value to somebody? I think 10 years is like urgent for healthcare, the way that things move. I want the calendar to turn blue every time that I check a patient in. The sooner you can get a clinician involved, the better. I think the smaller practices, small to mid-sized practices, are gonna need to like get on board with tech pretty soon. I hate AI. I'm not implementing anything AI.
Hi, and welcome to our new episode of Digital Health Interviews. I'd like to remind you to subscribe to our channel, like this video, and comment if you have any questions. And I think you might have some questions because the topic we're going to discuss today is quite interesting and controversial sometimes. Our perfect guest to discuss this topic, her name is Bailey Morgan. Hi.
Hey, how's it going?
Pretty well. Let's start with your intro.
Yeah, so I'm a speech pathologist by trade. I worked with adults in the medical setting. I transitioned into beverage sales for startup brands throughout New York City. And then I kind of made my way into healthcare tech. I started working with a startup that was looking for speech pathologists with a sales and marketing background and for like new products. And I worked with them for several years and got some really awesome experience in like building a business and like all of the things that come with it that you don't learn as a clinician. And now I'm working with Athelis, who creates a lot of different health technology products, from remote patient monitoring to scribe products and revenue cycle. So really cool journey.
All right, so you have this impressive career path transitioning from being a speech pathologist, that's the right word, to basically clinical product specialist.
Yeah.
Does your clinical background help you, or does it change your approach in doing the work you do right now?
Yeah, I think that it does, and it did in my last role as well as the one that I am now, in a variety of ways. One is, in my role now, I'm following a sales cycle essentially, so I'm building trust a little bit quicker with other clinicians in the space. But I think even more so, like on a deeper level, I understand the product better, I understand the pain better, I understand like the reasons why these things were made, and I also have my own reasons why like I left healthcare. Yeah, it definitely helps kind of approach things differently than I think that if I didn't have a clinical background, I wouldn't like appreciate as much. So. All
right. Tell us a bit more about your current company and your main responsibilities.
Yeah, so with Athelis, I'm a product specialist, and I work with specifically the revenue cycle line. So we use AI technology to automate about 80% of the revenue cycle. And if you're not familiar with the revenue cycle, it's very sexy. Submitting insurance claims and kind of going through that whole process is a pain for anybody that's done medical billing before. So we use AI to do a lot of like the things that humans would need to do, like logging into payer portals, things like that. So for me, I think that is really awesome because the margins right now in healthcare, especially if you're in private practice, are not great, and they're competing with big hospital systems. So, happy to be part of the change that's giving like more revenue back to practices. So.
And you're focused right now only on private practices, or you try to approach bigger health systems as well?
So we have other product lines that work with larger systems, or that we work with larger systems in. For example, like there's a product called Strongline, which is a safety awareness tool or a safety alerting tool for nurses. So if they have like an aggressive patient, they can hit it on their badge. It'll bring them help. I am working more with the private practices, mostly because it's challenging, as you know, to kind of like break into a health system. But I have small and large practices I work with, so yeah.
So we all know that selling to health systems and private clinic practices is very complex. And can you tell us what are the main challenges and how do startup founders overcome them? How should they overcome them?
Yeah, I think it's really hard in health tech. It's adoption is something that kind of is difficult to overcome, as well as change. Like, for example, doctors' offices use fax machines still, and people are surprised and think I'm joking when I say that, but there is definitely like a resistance to change. And I think like tech is only as good as the adoption is. And a lot of times health systems, like because the margins are so small and because productivity is so ramped up, it's hard to have time to be like evaluating other tools or products or vendors or things like that. So I think for founders, having a emphasis around how you will implement the new product and how you're not just going to kind of like hand off the product and say, okay, see you later. That is a really big key for winning in the health space, I think, personally.
Trust is critical for doing the sales in healthcare. How do you gain trust with healthcare executives and decision makers? And can you give us some tips?
Yeah. So being a clinician in healthcare tech, there's always kind of a balance that I need to hold between bringing my clinical colleagues good technology and also like winning at my job and making sales and doing, all those things that I need to do. So I always approach it by like, how can I provide value to somebody? And it might not necessarily be like about the product that I'm selling perhaps, but like if I'm at a networking event and I hear that somebody is trying to develop a new website and they need help, like happy to connect them with somebody that I think might be a good fit for them to work with. So I think, in sales in general, because I am in a sales role now, like you never want to push anybody. I try to have all of my relationships be organic. Like when I am stopping by a practice or doing some outreach or something, I am mostly doing it to connect with that person as an individual on the clinical level. And then if the products that I work with or the services that I can provide seem like a good fit, then I will talk to them about that. But I don't even know without having conversations with somebody if I could even help them. So it's always like, I always want to get to know people first. And I think that helps because the trust is authentic and it's not like I'm like waiting to ask something behind the scenes. Like I always want the best for everybody. And yeah, there's a balance to be struck, So
you kind of talked more about like the first contact, like when you approach and you start building those relationships. But then once you already know the person, any recommendations how to keep that relationship going?
I guess the other recommendation I would make is be somebody that's easy to work with. So I think that especially if you're trying to talk to MDs who sometimes are in like executive positions that are also still treating patients, which many of them are. I think like being mindful of that and I think that sometimes we have a tendency to like people in general like over explain and want to say it all. And I think like being quick, being concise, easy to work with, those are things that are also helpful for like any executive, but especially doctors who are like back to back with patients. And I think like just being mindful of that as well. Like there's a lot of emotional ownership that you take as a clinician. So having a salesperson or any type of product founder, whatever, trying to push something on somebody isn't going to be well received in my opinion versus trying to build an authentic relationship first with them.
Makes sense. And kind of it's a follow-up to my previous question. When you did the first pitch to an executive of a tech solution, and potentially an executive might be super excited about it, but because of the sales cycle is so long in healthcare, in few months, probably another 50 people pitched another idea to that person. So how do you get that momentum going through the whole sales cycle?
I think really understanding from a sales perspective or like a founder and product perspective, really understanding your buyer and the problems that they have, I think is the way to keep the connection and also like maybe like shorten the sales process because like any healthcare implementation is always going to take a really long time. But I think that you can this is going to sound like all the like typical cliche advice, but it's true. Like the more people that you can talk to in the organization, the better. I think that there's like within reason and being, tactful and not like annoying, but building relationships within the organization. I think really understanding also the like benefits that your product brings. Like you should be able to say in plain English to somebody like why you're different than competitors. And I think there's actually a lot of companies that have a hard time doing that. So I think that is really important as well. And I think I look at like giving a product to somebody as like being a guide. So like you're guiding them, like you should guide them through like what are the next steps? What does this look like? How do we implement? Who do we need to talk to? Who does this have to get run by? What is the budget going to be? What are the objections that this other executive are going to have? Like, let's try to preempt them together. And I think like working together as a team, it's not like you versus them. Like they're on one camp and you're on the other. Like you're all working together in healthcare. It's a collaborative effort. So even as a founder, salesperson, whatever, yeah.
And I assume that every executive, they want to know what's going to be the ROI of each solution. Is it like something you present at your first meeting, like, hey, you're going to save that much time or that much money, or you're going to make additional money? Is that they're asking at the first meeting?
So I'm glad that you asked that question, because I would love a chance to plug Apellis for this, because this is something that they do that I think is really unique and not seen too much in the space, is that we do a free financial health analysis that much more clearly shows the ROI, which I think is really important in tech also, because I think there's a lot of tech companies that say like, oh, we can do this and we can do that. And like, all you can really do is cross your fingers and hope that the tech is going to work. But we provide like data-driven insights based on how the current company is currently billing versus like how our partners are billing. So I think that is actually really, really helpful, because yeah, they do want to see the ROI, and not even like, I mean, the first ROI that you're even looking at too is like the time investment of like, do we even go through hours of meetings? Do we even get on a bunch of Zoom calls? So time is a big one, which is why I always say like being aware of the other person's time. And yeah.
Talking about tech adoption for private practices, can you tell us more, what other options of adoption technology besides the actual clinical implementation?
Yeah, so outside of like clinical and billing workflows, I'm also seeing like a really high increase of health systems and private practices implementing CRMs. So I saw for a while they would use like Monday or like Asana or like some other project management system, but now I'm seeing systems use like proper CRMs. So that's really interesting, as well as for like, I think marketing is becoming something that private practices didn't really do before, that now they're doing a lot more of. And I think the other area for tech is like design, because a lot of clinicians aren't like designers, let's say, but they're realizing they need like a brand and a website and all of these other things. So I think like all of the like revenue driving activities that you could do or initiatives that you could do, that is where there's like a good opportunity for tech as well.
And also, like your current one of the solutions you're trying to sell to practices is AI based. Can you tell us like when you try to sell AI based solution, what do executives like? What's their reaction? AI? What is that?
I just booked a meeting today with a practice that I followed back up on, and she was like, I hate AI. I'm not implementing anything AI. But then she also let me schedule a meeting to come to her office. So we'll see if I can convince her. But that is not uncommon though. That is like usually, I would say though it's 50-50. There's either health systems that are super AI forward and they want the tech, they're into it, they buy into it. And then I think there's the other side of the camp that is like, nope, no, I don't want it. And I think like both sides are valid. I think it's all about education. A lot of times healthcare providers are worried about like HIPAA compliance, obviously, things like that, patient information, because we could get into a lot of trouble for those things. I think like that is like specifically the biggest hang up around it, is like, how does HIPAA fall into it? Is this AI tool HIPAA compliant? And then also accuracy, because obviously we need to be accurate in our documentation and whatnot. So I think there's still going to be a period of like where we don't really trust the AI all the way. Like you see a lot of these like scribe tools and like I don't think we're at the point yet where a scribe tool will just like do the note for you and you won't even check it. I think we're still in the like phase of like I don't trust the AI enough yet, but I do think we'll get there where it does what you need it to do without you having to like go back over and check it. And I think over time, like all of the regulations and like guidelines around HIPAA are going to start to be fleshed out more as AI continues to be dominant in the tech space. So yeah.
Your prediction, is it going to happen in 5 years, 10 years, 2 years maybe?
I don't know. Well, like I said, we're still using fax machines. So I definitely don't think 2 years. I think like, I don't know. It depends. A smaller practice, I think that the adoption is going to be sooner. It's going to be like 5 to 10 years because I think that it's going to become harder and harder for private practices to hang on with hospital systems kind of acquiring practices. And the reason for that is mostly because it's more lucrative to work for a hospital system. It's not necessarily better for the patients, but it can be cheaper for them, and the clinicians get higher rates. So it's hard to compete with that. So I think the smaller practices, small to mid-sized practices, are going to need to like get on board with tech pretty soon, or else it's going to be not a good time. I think the larger systems, those I don't know. I mean, I could see those being even more than 10 years before things are really adopted, but I think there's definitely enough pain in the healthcare system right now that it's urgent. I think 10 years is like urgent for healthcare, the way that things move. So, but those are kind of my predictions.
Since you mentioned bigger health systems, any specific advice on how to approach them comparing to private practices? It's like a different universe of some sort.
Yeah, it is a different universe. I think being open to building relationships with anybody, whether they're like your decision maker or not, is good. Authentic relationships. I think also knowing the right decision makers is really important too, because you could spin your wheels and not really talk to the person that you need to talk to. Fortunately for New Yorkers, and this is probably true in other places as well, but I do a lot of networking events that have a lot of health executives at them. And that has been a great way for me to get in front of healthcare executives who are otherwise typically pretty busy. And they're usually like laid back events. They're like happy hours or cocktail hours, nothing like too formal, but those have been some of the actually best connections that I've made within the industry. So, but I think also it just goes back to like being mindful of time, of people's time. And I think that like it's common sense, but it's good to say it out loud too.
So besides an advice of going to lots of happy hours with executives, what other piece of advice would you give to startup founders that are building in health tech specifically and are planning or already trying to sell to healthcare systems?
I think that if you have an MVP, then you are ready to go take it to somebody. I think that you should go ask the clinicians what they think, because you can build really awesome tech that does all of these awesome things. But if people, like, you shouldn't build it with like a people will come attitude. You should go as soon as you have a first iteration of something and start getting the feedback from clinicians, because it's either like clinically correct and usable or it's not. There's like no middle ground. And I've seen companies do things that are just assumptions that are incorrect. And then you waste a lot of like development time and energy trying to like fix those things. So I think like as soon as you have any shape of a product, go bring it to somebody. And I think that's true in any product development, but healthcare especially, because there are clinical guidelines that we're following. Like it's things sometimes that it's not an opinion of ours that we don't want this or don't. It's because we have to, because insurance companies and whatnot. So I think, yeah, the sooner you can get a clinician involved, the better. The other thing I think I would say is, on the flip side, I would take all of the clinical input towards product development with a grain of salt. Grain of salt, what's the saying? And I would also focus on if they say like, oh, I want the calendar to turn blue every time that I check a patient in. I would look at that as like, I need a way to know when a patient is checked in, not necessarily that I need to make the calendar blue. Because I think you can also get a lot of like, when you're talking to people who don't have technical backgrounds, they can make a lot of suggestions that if you take without proper planning and implementation can send you down a rabbit hole. So I think getting the feedback is really important, and then finding out what is the actual problem that they want to solve, and not just like what is the feature that they want, or like what do they want it to do, because they don't really know that, but you can pull that out.
That's a good one. I love that. Yeah. Thank you, Bailey.
Yeah, thanks for your time.